Good evening, friends. Today's topic, sorry for cancelling last minute the last week webinar. Today's topic has been decided because a lot of us practitioners are going through immense stress. Everybody has their own reasons. And now, when most of us are increasing in age, when age-related disorders are getting common, stress is adding to all these problems. As a practicing community, we do not have any social security. If you're not invested your money well, you are in major trouble. And why I have written one is today we are going to talk a bit on why stress affects these particular organs. And for some time, we will talk on how you yourself can relax and manage your stress. Because see, there are two factors. As a doctor, I have a reputation in society. I don't want to go to somebody and say I'm in stress and I can't manage it. Secondly, our practice hours do not allow us to take out time and meet people who can help us stress. And at home, before, after midday, you can do certain activities and you can try to manage stress. So let's begin. What we must know about stress. This may help you for your own thing. But if you don't know stress and you don't control stress, stress will destroy you. We have seen patients who walk around with a cardiac neurosis, who walk around with a neurosis of stroke. We don't want to fall in that trap. You've seen people who get OCD. We don't want to fall in that trap. We need to manage our stress. Dr. Bina is saying she can't see the screen. Can others see the screen?
Yes, sir, it's visible.
Visible, no? Okay.
Yes, sir.
Dr. Bina, check at your end. Future shock. There was a book in 1970. Those of you who are readers and you are old enough to read the book of Alvin Toffler in 1970. This sociologist predicted. That was the time, when technology was changing. And he predicted that in few years or a decade, the civilization would become so fast that our biological growth will not keep pace. It will accelerate to such a degree that enormous number of people would experience shattering stress and disorientation. This was called future shock. There was a book called Future Shock. It was an amazing book. Those who read books can still look it up on Amazon. I'm sure it's available. And why this will happen? Because the technology has gone way ahead of human being. I'll give an example. In 1977, when I started my practice in Santa Cruz East, there was no lab in Santa Cruz East. We had to send our patients to Santa Cruz West to Asha Parikh Hospital. So you have a patient of 1-day fever, 2-day fever. You send for CBC. The report will take 36 hours. You have time to think on the possible diagnosis because we can only diagnose based on the patient's response. Today, The patient in 1 hour or 6 hours will ask you why fever is not gone. And on day 2, the patient comes with a fever profile done on their own. And you have to take a decision because you are a god. It's virtually impossible to avoid stress. Many try, but the avoidance strategies land up giving you more stress. There's a new word coined hardiness, stress toughness. Somebody who's able to cope the stress. People need to get tough to cope with the stress of future shock. Of course, when we talk of technology, we are under a lot of stress because of technology, because many doctors till today cannot understand or use computers very fluently. But we have our own stress, which we'll discuss as the time goes by. So hardiness is a word. Know, if you know very well, hepatitis B virus is a hardy virus. HIV virus, once out of the body in sunlight, will die within few seconds. HIV patient vomits, you put diluted bleaching water, you kill HIV virus. Hepatitis B virus does not die. It can remain in environment for years and decades. Again, example of hepatitis B virus. A patient of mine who was in a boarding school in Panchgani, and there before admission they do hepatitis B, C, HIV test. This guy fell down in the playground, abrasion on the knee, some dust particle went in. So the PT teacher picked up a pin, the so-called touchni, and tried to remove the stones. 2 weeks later, the child becomes sick, severe jaundice, hepatitis B positive. And the doctors concluded that the pin must have been used in some hepatitis B patients similarly. So we have to become tough to fight stress. So what is stress? Any demand, physical or mental, that is placed on your body. I am a smoker. I don't like to give up smoking. I know all the harmful effects of smoking, but still I love smoking. I can't work without a cigarette. Then a visit to a dentist, I am told that I have a precancerous lesion on my tongue. I have to now stop. That is going to give me tremendous stress. It is going to cause me get palpitations, get negative thoughts, my BP may shoot up, I will feel mouth dryness, I may feel shortness of breath, even sitting, what you call air hunger. Stress is different to different people. Even among our community, it may be different to anyone. Somebody who doesn't have practice, that is a stress. Somebody has too much, cannot even have time to eat, that is a stress. To the student, it can be exam pressure and stress. To the motorist, hassles of heavy traffic. To someone in a rickshaw or bus, obnoxious exhaust fumes will cause stress. So a stressor can be physical as well as mental or psychological. To a doctor running a one-man industry, we have no support. managing low business period, what we call as season thanda hai, when our liabilities do not go down. And at the same time, we want to have good practice. So all these things give us stress. How stress diagnosed? Not by causes, but by the symptoms. Instance one, I will give you. You had a patient who came to you last night complaining of burning in the chest, non-hypertensive, non-diabetic. You gave mucan gel, you gave a shot of pantoprazole, and you sent home. Tomorrow, next morning, when you come to the clinic, your compounder tells you that patient died in sleep. Now, first pang of stress has started. Then, when the compounder tells you few of his family members have come and they're talking quite loudly, you are stressed because what will happen? Will they get physical? Because people don't give time to you to explain. The biggest fear that every doctor has is, Doctor Sahab, did you not come to know that this is critical? So that time you get a feeling of palpitation, thumping in the chest. You get a funny feeling in the pit of the stomach. You may get perspiration. And if you already have a loose stomach, you may rush to the toilet to pass stool. Instance two, your compounder tells you, gives you a card, and Mr. So and so, income tax department. Now it is known that doctors do not know much about money. You may not even remember how much tax you paid last time. You may go through a similar set of symptoms. Thirdly, you are walking in a lane, you have got down from a bus or a rickshaw and walking to your house. The lamppost in your lane is lamp is gone. You are alone in the dark lane. It's 11:30 in the night and you hear footsteps behind you. And that again, you get palpitation, you get dry mouth, you get empty stomach, empty feeling in the pit of the stomach. Symptoms are same. You are stressed. Scenarios are three different. Hans Selye is a scientist who's considered master of stress. So stress is the non-specific response of the body to any demand placed upon it to adapt. I am told to follow this path, stopping smoking. I was in love with a girl and the girl said no and she got engaged and she said, don't talk to me again. I am forced to adapt. Whether that demand produces pleasure or pain. So you don't get stress only from negative stimuli. This actually happened in my practice. A patient of mine came to me and said, Doctor, a funny thing happened. I met a college friend of mine, a girl, and we had a relationship that time. And we fortunately had a place, so we got into necking and kissing. And he got massive palpitations, he perspired, he got scared that he's getting a heart attack. So again, this response, you can get stress from pleasure as well as pain. whether the demand is physiological or not. What is the holistic medicine view? Stress is the inability to cope with a perceived or real threat. It's a threat. I may get cancer because I have a precancerous lesion. I have to quit smoking and I am not able to cope with it. So I run around to doctors with palpitation, with other things. It could be a mental worry, could be a physical. I'm walking in the road, behind me steps. Somebody may rob me, somebody may kill me. Emotional. It could be emotional. A boy has proposed to a girl and she said, okay, tomorrow let's meet for coffee on at Starbucks and I'll tell you. He's waiting and he sees her coming. Till she reaches there, that's emotional stress and he's not able to cope it. Spiritual well-being, this let's not get into because you can spend hours together. I'll give you another example of physical threat. A patient of mine was robbed on the highway around 10 p.m. by a brown color Maruti van, 4 people. It took him almost 3.5 years to get over the fear of seeing a brown Maruti van in his rear view mirror. And this stress gives a physiological responses which we have to adapt to. And the physiological changes occur, making our body adapt to it. Now, the stress response is commonly known as a flight or fight response. I hear footsteps behind me. Now I have two options. Either I can run or I can turn and see if whatever the threat is and I can fight. Both require energy. I'll explain with a case. A young girl, newly married, second day of marriage, mother-in-law shouted at her in the kitchen and she fainted. When asked the history, she told mother-in-law that I want to talk alone. Then she said, Doctor, there was no fault of mine. I that time felt, she actually used these words, to run away from the house or to give her two slaps, fight or flight. But she was a cultured girl. She didn't do anything. And the stress response made her faint. Arousal happens for non-physical stresses, mental, emotional, spiritual. No matter whether the threat is real, a car accident, or it's a perceived noise at night when you're walking, the stress response occurs and it is the same. The stress response occurs in proportion to the perceived danger. What is the threat? The response will be as per that. So how does stress response occur? Little bit of medical knowledge now, physiology. Stimuli received by the brain through one or more of five senses. As we know that our immunity, when it sees a foreign particle, immediately decides self or non-self. And non-self, it reacts. Similarly, brain perceives whether this is a threat. Nobody need tell you that the steps behind you are a threat to you. Nobody need tell you that income tax officer may have just come to ask you, what is your PAN number? Have you been filing tax? But no, it's a perceived danger. Brain deciphers stimuli either as a threat or a non-threat. And if the brain feels even slightest level that this could be threatening to me, the brain starts the response. Body stays aroused until the threat is over, and then to return back to normal, threat is gone. So a mother waiting at the road for a bus to come, 2 o'clock is the bus to come, she has to pick up her child. Till 2:30 the bus doesn't come, and the coordinator in the bus is not answering the phone. She is going through stress. And then when the bus comes at 2:32, it takes her 10 minutes for her stress symptoms, the palpitation, etc. to go down. So what are the symptoms? Now, when I have to run or I have to fight, I need more blood, I need more energy. Who's going to give me more blood? My heart. So heart has to pump more number of times, you get tachycardia. Your BP goes up because the blood has to reach the tiniest cell of the body or the muscle fiber in order to enable you to run or fight. Ventilation increases because every time you take a step running or you fight, you need air, you need oxygen. Vasodilatation of the arteries to body's periphery. For running and fighting, you need to use periphery more than the trunk. So the blood goes more to the periphery. The blood sugar levels rise because you need energy which is coming from sugar. Now, if you see, no, all these five, people who are stressed will have resting tachycardia. People who are stressed land up with blood pressure. We know that stress is the cause of primary hypertension. Ventilation, difficulty of breathing. The Hindi saying, मैं इतना डर गया कि मेरी सांस रुक गई. I was so scared that I could not breathe. Vasodilatation of arteries to body's periphery. There is less blood going to the trunk. Your stomach needs lot of blood for it to perform as a concrete mixer full day. You start feeling emptiness in the stomach. The stomach is not working. You will end up with hyperacidity and ulcers. And with stress, you will end up with pre-diabetes and maybe later on diabetes. So I have just shown you 5 chronic ailments coming up from stress, unaddressed chronic stress. Increase free fatty acid mobilization, again, for this to convert to glucose and give energy. Increase muscular strength. Your muscles have to be stronger to fight or run. Decrease gastric movement. Because you require more blood at the periphery, stomach does not receive so much blood, so movement reduces. So the funny feeling which you get in the pit of the stomach is because the stomach movements have reduced. Increase perspiration to cool body core temperature because the peripheries are getting hotter. The center has to cool. Cool. That is why the perspiration increases. And pupils dilate because of fear. There are two emotions connected with stress. The major one is fear and second one is anger. So I'm going to explain to you what chemical changes occur in the body. Our cerebral cortex identifies a stimulus which could be threatening and it starts action immediately. Through reticular activating system, acts on hypothalamus. The stimulus directly, the threatening stimulus also is perceived by hypothalamus. Through corticotropin releasing factor and thyrotropin releasing factor acts on the pituitary. Hypothalamus directly also through sympathetic nervous system acts on adrenals. Pituitary also acts on adrenals through ACTH. Pituitary through TTH, thyrotropin hormone acts on thyroid. Now both adrenal and thyroid hormones, thyroxine leads to physiological arousal, and here adrenaline, noradrenaline, cortisol, aldosterone all lead to physiological arousal. What is physiological arousal? High pulse rate, high blood pressure, high blood sugar, higher ventilation. So again, symptoms of stress. Hypothalamus activates adrenal glands to release adrenaline and cortisol into circulation. Adrenal glands secrete more adrenaline. This adrenaline in circulation, blood supply to muscles increase, sweat glands produce more sweat, cooling of body, heart rate increases, pupils dilate, rate of breathing increases, leading to shortness of breath. So the 5 to 6 cardinal symptoms of stress, physiological symptoms occurring because of adrenaline in circulation largely, maybe to some extent thyroxine and cortisol. And this, which we should understand, is the stress chemical. Immediate effect of stress, sympathetic nervous response, epinephrine and norepinephrine released. Time is 2 to 3 seconds. People will tell you, Doc, I was fine. And suddenly they will describe that my pulse rate went up. I fainted. I didn't know. I started perspiring. It's like a phone call. Instant result. Intermediate effects, again adrenal response. Epinephrine, norepinephrine released from adrenal medulla. It's like an email you receive. But again, the same effects that came up instantly continue because adrenaline continues to being secreted till the threat is over. Prolonged effects of stress, ACTH, vasopressin, thyroxine affect various metabolic processes. Time, minutes, hours, days, or a week. It's like a regular mail speed post or through our postman. So again, this is long-term effect. How does the stress reactivity influence our body's functioning? You know, as we say, we get scared for some time, but then why it should have lasting effects? It affects the cardiovascular system. It affects the GI system, affects the muscles. What problems of muscles we have? I'll narrate a case here which actually happened in my clinic. This 23-year-old girl came with a huge bag of reports, neck pain, and severe pain she had. When I palpated, the shoulder blade muscles were as stiff as a steel cable. How do you abuse your neck? I don't abuse. Okay. Do you use mobile in lying down position? No. She had gone through X-ray, MRI, nothing, bang normal. So when did it first start? Started about 1.5 months back. Can you describe how it started? No, I was coming down from my building, 23rd floor in a lift. And then just before the lift could close, one boy walked in. I said, "You knew the boy?" He was from my office, but we didn't speak. We don't speak to each other. So what was the reaction? Like, you kept quiet 23 floors? No, I was worried whether he'll try to force himself upon me. I said, so. And then I reached home and I had slight pain and I did hot water fermentation and it went away. I was that time, this is the story about 9, 10 year old. I was that time preparing a talk for stress for one company. So I associated this, that this girl's body was preparing for fight or flight because of the stress, whether he's going to force himself on her. Now, if she has to run, she cannot run because it's in a lift. So she has to fight. And fight, in addition to all physiology, I asked her, were you getting palpitations and all? Yes. She was bracing herself to attack. I said, does that similar situation happen again? It may have happened about 8, 10 times in 1.5 months. But any other time, then you feel threatened. Do you get similar pains? Yes, like I felt the worst was when we heard some shouting from my boss's cabin and the boss called for me. So I thought I am losing the job. That day also I felt the same thing. Muscle, we have to brace. So a lot of neck muscle problems, a lot of lower back can be attributed to stress. Skin, we know that a lot of skin conditions, eczemas worsen with stress. Immune system go down, stresses get more allergic rhinitis, more asthma. Non-asthmatics will get an acute attack with some stress. What happens to heart? Increase heart rate. We have seen it already. Increase blood volume or increase blood pressure. Constriction of certain blood vessels. Coronary artery disease. Angina post-stress. Dilatation of coronary arteries. Increase force of heart contraction. Again, BP goes up. Increase blood glucose, free fatty acid and cholesterol, dyslipidemia and hyperglycemia. Decrease saliva, they feel dry mouth. Contraction of esophagus, difficulty in swallowing, they will have. And since the esophagus is behind the heart, the difficulty in swallowing is perceived as a heaviness in the chest. Increase acid in the stomach because the stomach is not moving like normal. It's not emptying. You have higher hydrochloric acid there. And stress people get ulcers very fast. Change in peristalsis, dyspepsia. Doc, I'm not feeling good. I feel bloated. Other changes, skeletal muscle, increased tension, bracing and pain. What I just explained to you. Smooth muscle, increased contraction, increased perspiration, decreased temperature of the skin, feeling cold, I feel chilly, immune system weakened, allergies, asthma, hay fever, rheumatoid arthritis, backache, temporomandibular joint syndrome, because people in stress keep clenching their teeth often. Hypertension, essential, stroke, coronary artery disease, ulcers. A patient who has 3 endoscopies done normal and comes to you and talks of burning in the chest, you have to put away the reports and say, so what is bothering you? Tension, headaches. And of course, cancer also is stress related to stress, but then no, not all cancers. We have to first rule out other causes. Dr. Suman Rao, who's my colleague in my clinic for last 15 years, she is a diploma in yoga from Yoga Institute. She'll be talking on 2 aspects of relaxation. I will be talking on first 2, deep breathing exercise and guided imagery. Now, when we have stress, no, let me stop the slides. When I have stress, my mind is focused on what may happen. So I have to focus back on something with my will. And half the problem of stress is gone. So the best exercise that I have learned and which I practice and I advocate to my patient, because see, we all have patients who irritate us, who make us angry. And before the next patient, you have to come down to normal level. You can't shout at the next patient. So I use 15 seconds to 30 seconds based on the irritation or anger that I have got. Breathe in. Now, when you breathe in, your thought may still go somewhere. You breathe in and count till 4. Slowly you count and you breathe in. So your mind is focused on counting. Your body is focused on breathing in. Hold for 6 seconds. So your mind is busy counting 6. And exhale for 4 seconds. This breathing exercise with counting in the mind removes your focus from the anger or irritation that the previous patient gave you, and you are little on normal. Then I don't want to think of the fellow who irritated me. Imagery. All of us, whatever stress we may have at least 5 things in our life which, if we think, will bring a smile on my face. Your marriage, your first date, your first child, your graduation, getting into medicine, somebody praising you, your grandchild. After you have taken one breath of 464, you think of the first image in your list of 5 list and you get a smile on your face. Believe me, many cases, second breath is not required. People who get irritated in the office, see, you have to do meditation every day at home. But when people get shouted by the boss, I tell them, go to the toilet. Nobody will disturb you there. Over 2 minutes, 8 breaths, 8 times thinking of somebody loved one, somebody who can give you a smile, and you are relaxed enough to come and face the world again. These are the things which I recommend. And meditation to me is focusing on something on which I want to focus. So if you are a doctor and you have a child of 6 months, and the mother comes and says, I have been told my child has a hole in the heart. You're not a cardiologist, you're not an expert, but you want to see whether there is any murmur. That 1 minute that you auscultate, my dear, you will block everything, and that 1 minute will be your meditation. When an 80-year-old woman puts a needle, a thread in a needle, that is her meditation, because she is concentrating on that at all. So invite Dr. Suman Rao, MBBS, with diploma in yoga, to talk on meditation and the technique of body scan meditation. Dr. Rao, please.
Namaste and good evening to all of you. So today, right now, I'm going to talk to you about meditation and relaxation. Meditation is also a form of relaxation, and but all relaxation is not meditation. So first, I'll go through relaxation, which is most important. As Sir said, our skeletal muscles are all very tight, and that is a cause for back pain, neck pain, and sometimes even if the muscles are tight and you get the periphery, blood circulation is not good. So neuropathy also could be a problem. So I'll take you through a guided relaxation, which would help you to relax. But relaxation is progressive muscular relaxation, like body scanning. You scan your body either from the toe to the head or from head to toe. But I prefer toe to head, because once you reach the head, you're totally in bliss and totally relaxed, and you can enjoy that situation. So can we do this meditation now? Okay. Please, all of you, sit in a very relaxed position. Take a back support if you need. And if you're behind the wheels, you're driving or something, please avoid. But otherwise, keep your hands on your lap. Gently close your eyes and be aware of your body. Now take your attention to the toes. Contract your toes, make it tight, and gently relax. Contract your foot muscles and gently relax. Now contract your ankle, keep it tight, and gently relax. Contract your leg muscles, the calf and the shin, and gently relax. Contract your knees, gently relax. Now contract your thigh muscles, both the hamstrings and the quadriceps, and gently relax. Now contract your groin muscles and your perineal region, the private parts, and relax. Relax, contract your lower abdomen, the pelvic area, and relax. Now contract your lower back muscles. Gently relax. Let's go higher. Now contract the abdominal muscles above the umbilicus and the flank and the lumbar area and the lower thoracic, and gently relax. Now contract your chest muscles and the side of your chest and your back muscles, and gently relax. Now come to your neck area. Contract your neck muscles in the front, at the back. Gently relax. Contract your shoulders and your entire hands, both your hands, from the fingers, the wrist, the elbow, the forearm, the arm. Contract and gently relax. Now all your muscles, the entire paraspinal muscles, the abdomen, the leg, everything is relaxed. Now relax your back of your head. Same way, contract and relax the upper part of your head, the entire scalp. Contract your forehead and gently relax. Now contract your facial muscles. Contract your jaw. Keep your teeth clenched and relax. So as you relax, your teeth is separate, your jaw has fallen down, your tongue is loose. Contract your cheeks and relax. Your eyebrows are contracted and then relax. Your nose is contracted and relax. Now come to the point between your eyebrows. Contract and relax. Now your entire body is relaxed. Just experience this relaxed body. If you feel any tightness anywhere, you can take your attention there and relax it more. And be in this relaxed state for 30 seconds. Now slowly move your fingertips, your toes, and when you feel like, you can gently open your eyes. Now this is a progressive muscle relaxation technique, which you can do on a day when you're very tired, just before going to bed. It just relaxes all your muscles, your tights, neck, if you have a headache, and it really calms our mind. And now I'll go to meditation. Meditation is a different thing. In meditation, you are aware of what is happening. You are aware, you're attentive, and you try to adjust yourself. Whereas in relaxation, you just let yourself loose. Whereas in meditation, you're aware. Now for meditation, now let's close our eyes. I'll just go a quick way how you can meditate. Even 10 minutes of meditation per day is enough. You need a very comfortable clothing to meditate. You have to select a place to meditate. But of course, if you're traveling, if you're in the car, you can sit and, of course, behind it with the driver. Then you can meditate. That your commuting time, you can make use for meditation. Preferably a calm environment and preferably empty stomach, so that you can, because the digestion is not there and you're totally relaxed. Shall we close our eyes now? Take a position. Take a relaxed pose. Keep your eyes closed and your hands on the thighs. Now, gently be aware of the happenings around us, the environment around you. You may be hearing the noise of the fan, or the AC sound, or the rain outside. Take your attention gently towards our surrounding. Be with the surrounding. If you can catch hold of one noise, one sound, take your attention to that particular sound. If your mind wavers, gently get it back to that sound. Be one with the sound. Accept the sound and be with the sound. Now gently be aware of your body. You may be uncomfortable or some discomfort in a joint. Be aware of it. Pain somewhere. Be aware of it. Be with it. Accept it. And just be aware of your body. Accept. Acceptance is most important over here. Bring our attention to the tip of the nose. Gently feel the air that we breathe, the cool air that's going in through the tip of the nose, and the warm air that comes out. Be aware of this air that we breathe. Be one with the breath. Now, take your attention to the thoughts. The mind has so many thoughts. Let it come. It may be good thoughts or fearful thoughts or thoughts about future. Let it be. Let it come. You be aware of it. Watch it without judgment. Be with your thoughts. Now gently take your awareness to your emotions. It may be a happy emotion. It may be anger. It may be sadness. It's okay. Just accept and be with it. Be with it. And be with it. In this state, right now, you are doing nothing. You want nothing. And you are nobody. You are just a being. Just be. Enjoy this blissful state, the pure state, relaxed state. Be here for another 30 seconds. Now gently take your attention back to your emotions. Gently take your attention back to the thoughts. now to your body, and now to the environment you are sitting in. Gently open your eyes. Meditation takes you to a state of awareness. So once you do this every day for 10 minutes at least, you become aware of the thoughts, the emotions that we go through the day, and it would help us, and slowly the number of thoughts also reduces, so we can focus on what we want the mind to do. We can get calmer, and most important, the mind comes in our control. Otherwise, mind is like a monkey, keeps jumping around. But everyday meditation, you get the control of the mind, and that's the ultimate. And our production increases if the mind is with us and we have the power of mind. Thank you.
So friends, thank you for the patient hearing. Now, next week, I plan that some of us should talk of our experiences. So I will wait till Sunday. Send your message to Preeti or me that you would like to speak for 5 minutes on how you manage stress. If I don't get responses, I may think of a clinical topic for next time. And thank you, Dr. Suman Rao. I think first is we have to accept that we are stressed, then take steps to fight it. Most of us want to deny that, I have no stress. I'm used to it. I've been taking all this shit all my life, but that doesn't work. Yes, I have stress and this is how I manage. And most of the doctors do not have a pastime. They don't have a hobby. Pick up a hobby, develop a pastime, and then life will be very easy. See you next week.